The client diagnosed with pericarditis is complaining of increased pain. Which intervention should the nurse implement first? Wow, great scenario. We know it's a priority scenario because we see first. It does not give you a lot of information about the patient. It just says the client. That's it, nothing else. So in this scenario, it's not important. Keynote, in case you didn't know, if it doesn't specify the patient is an adult. Okay? Always, it's an adult. Unless it says pediatric patient or an elderly adult. So we're dealing with an adult that was diagnosed with pericarditis. So this is the medical diagnosis. And this is what the patient is complaining of increased pain. The word increase means change in condition. What is that telling me? What is the level of pain? What did it increase to and from? Because, for example, if I tell you that the patient had a pain level of 2 and now has a pain level of 3, did it increase? Yes, it increased, but that's not a big problem. But if it increased from 1 to 9, well, it went from a mild type of pain to severe pain. So in this scenario, we don't have a whole lot of information about the pain. So the data that we have is subjective in nature. Is it an emergency? I don't know. Because chest pain in pericarditis is expected. Now, what type of pain? What is the severity of the pain? So in this scenario, we're probably looking to do an assessment and validate the information that we have on the stem of the question. Administer oxygen. This is an implementation. Evaluate, assessment phase. Urinary output. That's important. Assess the client for cardiac complication. Assessment. Validation. And encourage the client to use the incentive spirometer. Teaching. This is an implementation. Well, we already talked about an assessment has not been completed in this scenario because all we have is something referred from the patient. And I cannot tell if this is an emergency or not. So I'm going to go with an assessment. So I can eliminate answer number 1. Wait, professor, you eliminated an answer that says oxygen? Yes. Why? There is no clinical indication that the patient is in any type of respiratory distress. So there's no need to provide oxygen on this patient. And this is a very common misconception with nursing students. Every time they see oxygen, they want to click on oxygen. Every time they see assessment, they want to click on assessment. No, it depends. It depends on the scenario. So answer number 1, we can eliminate. Why? There's no clinical manifestation of a respiratory problem. Assessment for urinary output, thinking more on circulation as well. Assessment for cardiac complications. Multiple complications. This is a good assessment. And number 4, encouraging to use the incentive spirometer. Can this help the patient? Yes, in the future, but it's not my priority action at this moment. So we can eliminate answer number 4. And in between 2 and 3, which of the 2 answers go directly to the problem? Pericarditis is a cardiac problem. So I need to do an assessment and look for cardiac complications to identify if this pain, if it's secondary to pericarditis or if there is another type of complication going on that is causing the pain. So answer number 3 is the correct answer.